Because a stitch in time saves 9. The awareness around lymphedema needs to be increased, not only in the patients, even in the doctors. For the very first time, there is something beyond lymphatic drainage and other things which has come to our disposal for these patients. Compliance becomes the biggest issue. Hi, I'm Dr. Kanika Sood Sharma, Director and Clinical Lead Radiation Oncology at Dharamshila Narayana Superspeciality Hospital. And today we are addressing a very, very important topic in oncology, that is lymphedema. And lymphedema is something which I have witnessed in patients for the last 2 decades of differing extent. And I think the understanding in the community about the presence of lymphedema is very, very limited. Most patients, despite being counseled very well by the surgeons about do's and don'ts on the operated side, still do not follow the instructions. So leading to that, there are patients who even end up coming to us in grade 4 lymphedema. Lymphedema we try to grade based on the extent, like early ones where there are no symptom, patient just feels heaviness in the arm, and then subsequently there is mild edema which weans off, then there is pitting, and then finally skin changes start to appear. So many times, especially from the rural background, we see patients coming directly with skin changes because they have been ignorant towards this particular problem itself. Their entire focus, as happens in any cancer, is towards treatment, in chemo, radiation, surgery, and they forget that these small things which have been instructed post-surgery would be elemental in preventing lymphedema. So we still witness a lot of lymphedema. Although I would say a surgical side now, a lot of things are happening, but again, it is there only in limited centers. There are certain centers in the country where during the surgery itself, they are making lymphovascular anastomosis so that the risk of lymphedema is brought down drastically. But this is not something which will go to the entire community. Out of the 100 patients we treat, only 1 or 2 patients will have access to such sophisticated surgery. So still, I would say it is a big problem still there. What is taught classically, any patient who's undergone, for example, a breast surgery, the risk of lymphedema is around 15%. And if we radiate the patient after surgery, the risk will double to almost 30%. So it is a burden for patients if it gets established, especially in grade 3 and grade 4. So see, approach to management of lymphedema is always multimodality. So as I mentioned, that immediately post-surgery, a lot of instructions are given to the patients with regards to avoidance of injury to the arm, not to lift heavy weights, and other instructions, and some shoulder exercises are also taught. But unfortunately, despite that every patient is given a leaflet with the set of exercises, patients are not compliant. Patients do not feel that exercise is that important, and they focus on other things more than the exercises. And compliance to the lymphatic drainage and the compression garment is also very poor. Especially in cities like Delhi, NCR, when there is a lot of heat, summers are pretty bad, patients are not wearing their garments. And sometimes I see when they come wearing the garment is not correct in fitting. It is an ill-fitting garment, it is hanging loose, or it is so tight that it is causing a lot of creases. So you don't have an appropriate lymphatic compression device, again, then it will start to hurt. So then patient stops wearing because the size is not appropriate. For exercises, sometimes patients give up on the exercises. What they say is that we've been doing it for a month or 2, it is hardly budging, it just goes down a day, and when I leave my bandaging, it comes back again. So I think they get disheartened also, because bandaging is also a very tedious procedure. If you start bandaging, and if you see, when you start from fingers to the armpit, sometimes it may take even an hour to do the entire bandaging. Although with time, patient get more dexterous, the time of bandaging may come down to almost 20-25 minutes, but patients find it consuming and they stop doing that. So I think that is a major limitation, that all the ancillary methods, all the manual lymphatic, or the measures to reduce the fluid, because majorly we are working in pushing the fluid from the interstitial tissue towards the heart. So there the compliance becomes the biggest issue. So see, I will be very, candid in telling you that like day one when this product was introduced, I was skeptical how much it is going to work. So with a lot of apprehension, I tried on the first patient, and patient is of a very intelligent background. They sent me photographs of the measurements. The patient's husband had taken very good measurements, 3-level measurements, and he had compared pre-Selenase, and I could see the benefit there. Unfortunately, that patient was grade 3 lymphedema. So if for grade 2 the benefit is more profound, the more late you start, the benefit may not be that appreciable, or it may take longer time. But I could see that there was a change in measurement, almost a drop of almost at some levels even 2 centimeters of change could be appreciated in the limb width. So that was something which encouraged me to start using it for the other patients also. I would say that it may not be a standalone solution, because it is acting on chronic inflammatory changes. So it is at the cellular level taking care of the inflammation, and the other measures, that is the lymphatic drainage or the compression garment, are adding to the benefit. So it would be a complementary treatment, it would be an integrated treatment, multimodality, where Selenase is part of the inflammation reduction process. So at least for the lymphedema grade 1, 2 and 3, I think it would be a very, very beneficial product to the patients, and it may definitely reverse the changes, so that the late effects like skin changes and hardening of skin will not happen if timely we have started the product usage. And the other thing is that when the patients start to see benefit, they are much more compliant, because it is just a medicine which has to be taken. They are more skeptical in doing measures like compression therapies and other things, because they have to go from their house every day literally. So something which is just at their arms width, and they can take that tablet. So compliance also, I feel, would be likely to be more in comparison to other measures. So surely I believe it will be a complementary measure, and I would rather say I was so happy that for the very first time there is something beyond lymphatic drainage and other things which has come to our disposal for these patients. See, as I mentioned, we have to triage our patients. Firstly, you have to first estimate that how much is the risk of lymphedema. So if there are patients where there is a higher risk, you sensitize them that you monitor your arm's circumference, because all patients will not do that. Mostly it is a reactive approach we take for lymphedema. It is never a proactive. It is not that all patients who've undergone a pelvic surgery or all patients who've undergone a breast surgery will be measuring their arm. So where as a doctor, I anticipate that this is one of my patients which is likely to have higher risk of lymphedema, we educate them that you keep your arm measurements also, and in case you find a discrepancy, then you report to us. Because till now what happens, it is the tailor who tells the patient, ma'am, aapki width alag-alag hai, which is surprising, because that is not how things should happen. Patient herself should be able to appreciate the difference. So where we find that there is a change in the arm width between the two arms which has started to appear, I think that is the patient I would encourage that she starts off right away, rather than reaching to grade 4, because grade 4 usually are very difficult to revert. If you are picking up early, the inflammatory process is being stopped at an early phase, the degree of benefit is likely to be more profound. As the lymphedema progresses from 1 to 2 to 3, so the benefit may go down. And even in 4, I'm not sure, because I haven't used in grade 4 as of now. So maybe in grade 4, we may not actually find much benefit. So at least in my practice, if I am given a choice, grade 1, 2 and 3 patients would be the one where I would be prompt in starting Selenase. So I think first and foremost, the awareness around lymphedema needs to be increased, not only in the patients, even in the doctors. As I mentioned, all of us are acting in a reactive fashion. Once the problem has occurred, then we start to find solutions to it. So if we are already vigilant, then the ability to treat the patient at the right time remains with us, because a stitch in time saves 9. If already patient comes with stage 3 of lymphedema, then patient also gets disheartened, because they come to you again and again. They've tried all measures. They're doing lymphatic drainage, self-drainage, bandaging. So they also get depressed. I have seen certain patients who have limited their source social life in totality. They don't go out because they feel very shy because of people asking questions that your arm looks very different. So as doctors, I think our responsibility towards our patient is to firstly make them aware why we are making them do those exercises, why we are giving them so many do's and don'ts on the operated limb. So awareness is something, and nowadays it is very easy. Now our patients can be given leaflets, they can be given small videos also at the time of discharge, so that they can apprise themselves. In the case they forget the exercises, they can be reminded by these small set of exercises. And it is very easy. You just have to share QR codes nowadays. So scammers are using QR codes, but medical fraternity is not using them. I think that reluctance of using digital as an educative media is somewhere, I think, existing in our scientific community. So I think that education is something I would be, requesting even the other stakeholders who are participant in patient treatment, that you should educate patients more, because that will give us a good opportunity to treat it well in time.